According to a study released earlier this week, tooth decay has increased significantly in the city of Calgary, where City Council voted to stop adding fluoride to public drinking water in 2011. The worst decay was found in baby teeth, but is adding fluoride to the public water supply the answer? Well, Dr. Joelene Huber joins us now to talk about some of the benefits and drawbacks. She's a pediatrician and professor of medicine with the University of Toronto, and she joins us live in studio. Thanks for coming in, Dr. Huber.
Thanks for having me.
So tell us what fluoride does exactly.
And so fluoride, a lot of people don't know, it's actually a naturally occurring element in the earth, in the soil, in the rocks. And as it erodes into our water system, we have some naturally occurring fluoride in our water. And so it's in things like water, it's actually in potatoes, carrots, we eat it, we drink it in tea. And so it's a lot, we're consuming it a lot, particularly it's naturally occurring in water. And what it does is hardens the enamel or the outside of the tooth and mineralizes it, and that helps to prevent tooth decay. So that since then they've added it into toothpaste as well to add as a topical fluoride to strengthen our teeth.
There seems to be some health concerns, though, about adding it to the drinking water, right? I've heard that in other cities. I lived in British Columbia, where it's not in the drinking water in Vancouver, and people have concerns about that. Why is that?
Right, so if you add too much fluoride, or if children have too much fluoride while the teeth are developing, there's a risk of what's called fluorosis, and that's what you see deposits or white blotches and sort of speckles on the teeth, and that's called fluorosis. So having too much fluoride is a concern, and it's a health concern.
Okay, but is it realistic to be concerned about it in your drinking water? You'd have to drink a lot of that.
Right, so Health Canada and the World Health Organization and the Center for Disease Control in the United States have some sort of suggested regulation, and when it's added or when the concentration in the water is adjusted, it's adjusted to a certain level that's thought to have benefit in terms of preventing tooth decay, but not so high to cause fluorosis. So there's sometimes some fluorosis seen in Canada, usually very uncommon and mild cases.
Okay, now we have seen with this recent study there in Calgary now, right, that fluoridated water can go a long way in preventing tooth decay, especially in younger teeth.
Right. So a lot of people think it's just the primary teeth that we saw in this study that you're talking about. In the primary teeth, there was more cavities in Calgary than in Edmonton, where they stopped the fluoride in the water. And we still need to be concerned about primary teeth. Oral health is a sign of overall health. The primary teeth are there for a reason. It's where children learn to eat, talk. If the primary teeth have problems or decay, it can contribute to problems in the permanent teeth and cause long-term issues, infection, pain. There's high costs associated with dental care. So the primary teeth also matter, and it's important to take care of them.
Yeah, I know when I saw dentists in BC, because I grew up in Ontario, they would tap my teeth and say, oh, you must have grown up in Ontario, because my teeth seemed so much stronger to them because of the fluoride in the water. But what should parents be doing anyway to protect their children's teeth, whether they're in a city that has fluoridated water or not?
Right, so there's all this debate of whether it should be in the water or not, and people have strong opinions either way. Regardless, the cavities are increasing in children across Canada, and it's a big health concern. So we want to start with good oral health care, and that starts in the newborn period. So as soon as babies are born, you want to be using a soft, clean cloth to wipe down the gums, even before teeth emerge, twice per day. Once a tooth emerges, you want to start using a baby soft toothbrush to brush the teeth or the tooth if that's all they have. Milk actually has a lot of sugar, and some people send babies to bed with their milk, and so that's just basically coating the tooth in sugar, and that contributes to cavities. So you want to, by 6 months, start switching to a sippy cup to sort of get away from prolonged bottle use. By the time kids are 12 months, they should be going to their first dental visit. A lot of people are surprised to hear that, but that is preventative in terms of good dental care. And by 12 months to 15 months, starting to use the open cup, again, to get away from that bottle. Then you want to start to use a trainer toothpaste. That's toothpaste without fluoride, and it's a trainer because children are learning to spit. So spit that fluoride out and learning to use toothpaste, and we know we want to avoid that risk of fluorosis. So you don't want fluoride until kids are about 3. When they're 3, you can start using a toothpaste that has fluoride in it, and it's the rule of 2. So this is a great example of one of the toothbrushes. This will blink for 2 minutes, and so kids know when it turns red that they can stop. So whatever you use, a timer or whatever you use, you want to do 2 minutes 2 times a day.
I have a timer on my toothbrush.
Oh, you
still.
do. So great. We should all be timing ourselves and doing it. And of course, flossing. And then, of course, we all know that sugar contributes to cavities. That's not a surprise, but there's some things that are worse than others. So sugary beverages, of course, and foods that are sticky and stick in your teeth, like caramels and these gummy candies. Prolonged sucking on sugary things can really cause and contribute to decay. So those are things that we want to think about. And then, of course, visit your dentist at least once every 6 months, and unless otherwise instructed by your dentist.
Great. Thank you so much, Dr. Huber. Thanks for coming in.
Thanks for having me.
Dr. Joelene Huber, pediatrician and professor of medicine at the University of Toronto.